Good afternoon, everyone, and welcome to today's webinar presented by SAMHSA STAIN Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is titled Self-Care for Criminal Justice Professionals Across the Sequential Intercept Model, Considerations for Intercepts 3 through 5. Our two presenters today are Jennifer Johnson and Judge Marsha Hirsch, and I will introduce them shortly. I am Melissa Stein, and I'm a Senior Research Associate at Policy Research Associates. Before we start our presentations, I have some housekeeping items to review. First, the views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or in regards to technology, please type them in the Q&A pod on the right of your screen, and we will address as many of your questions to the presenters as time permits following the presentations. We will also be conducting a couple of polls and appreciate your participation. When you see a poll pop up on your screen, please enter your responses. This webinar is being recorded and slides will be disseminated via the Games listserv following the webinar. We will also notify you when the webinar recording is posted to SAMHSA's YouTube channel. A certificate of attendance will be available for download at the end of the webinar. Please note this certificate is for personal portfolio use only, and we are not able to offer CEU credits. There is ASL interpretation for this event. In order to view ASL interpretation, go to Layout in the upper right-hand corner of the screen, then select Hide Participants with Video Off, then select Full Screen. Finally, select View All, and the View All icon looks like opposing edges of a rectangle. Our interpreters for today are Marcus Gunter and Trudy Gilbert. We also have live captioning for this event. To view live captioning, select the Continue or Accept button in the Multimedia pod, which is located in the lower right-hand corner of your WebEx screen. And the color contrast of live captioning can be changed as needed, and we recommend high contrast style for best visibility. And just a quick look at our agenda today. Coming up next, we have John Berg to give some opening remarks from SAMHSA, and then we will move into presentations from Jennifer Johnson and Judge Marsha Hirsch. Now I'd like to turn this over to John Berg, who is a Senior Public Health Advisor at the Substance Abuse and Mental Health Services Administration, for opening remarks. John?
Thank you, Dr. Stein. Welcome to today's webinar, Self-Care for Criminal Justice Professionals Across the Sequential Intercept Model, Considerations for Intercepts 3 through 5. We appreciate you taking time to participate in today's informative webinar. I know there's lots of things you could be doing, but I think you'll find this will be very worthwhile. SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. We know that this is a big challenge and takes a skilled and varied workforce to accomplish this mission. We also understand that delivering these essential services related to addressing SUDs and mental illness can be difficult and cause behavioral health workers stress and burnout. Self-care is a critical component of wellness for professionals across all intercepts of the criminal justice and behavioral health systems. Within intercepts 3 through 5 of the sequential intercept model, court, reentry, and community corrections personnel may experience stressors related to providing services and ensuring the safety of individuals experiencing crisis, mental or substance use disorders, or withdrawal symptoms. And with the COVID-19 pandemic this past year, many staff face an increased exposure to stressors as they navigate this additional challenge. Today's presenters will provide information about potential stressors faced by staff across intercepts 3 through 5 and ways that agencies can support self-care as a protective factor against harmful responses to stress. Presenters will share best practices resources, and supports that agencies and staff should be aware of to build resilience and promote self-care. I would also like to highlight SAMHSA has many resources that are available to assist with the important challenge of self-care. On our website, you can find the document Tips for Healthcare Professionals, Coping with Stress and Compassion Fatigue. I will post this in the chat if you're interested in accessing that. We also have additional resources created through our Addiction Technology Transfer Center and Mental Health Technology Transfer Center networks. There's a slide at the end of the presentation today with links to these resources. SAMHSA also recognizes the challenges posed by the current COVID-19 pandemic and is providing guidance and resources to assist individuals, providers, communities, and states across the country. There is a link to these resources on our main page. We are pleased to have Jennifer Johnson and the Honorable Marcia Hirsch present on this very important topic, and I want to thank them for taking time to share their knowledge and expertise. I'd also like to thank the Gaines Center and their staff for their work in developing and facilitating today's webinar. At this time, I will turn it back to Dr. Stein.
Thank you very much, John. And now I'd like to introduce our two speakers for today's presentations. First, Jennifer Johnson is the founder and principal of J.K. Johnson Advisors, and she provides education, consulting, and technical assistance at the intersection of mental health and law. She is a 20-year veteran of the San Francisco Public Defender's Office, where she was one of the founders of San Francisco's Behavioral Health Court. She was a co-founder of the San Francisco Police Department's Crisis Intervention Team training in 2011. She's also a consultant with SAMHSA's Gaines Center, and she's a member of the Criminal Justice Advisory Panel for the ARC's National Center on Criminal Justice and Disability. Honorable Marcia Hirsch is the presiding judge of the Queens Drug Treatment Court, the DWI Treatment Court, the Mental Health Court, the Veterans Court, and the Drug Diversion Court. She was appointed to the New York Court of Claims in March 2005 and was assigned to Queens Supreme Court criminal term. Judge Hirsch has lectured extensively on therapeutic justice, trauma-informed courts, and procedural justice. She is a past president of the New York Association of Treatment Court Professionals, and she joined the faculty of the National Judicial College in 2015. Prior to taking the bench, Judge Hirsch was the General Counsel and Deputy Commissioner at the New York State Division of Housing and Community Renewal. And now just a quick look at our poll results. So unfortunately, I'm not able to access those results, but thank you all for participating in today's meeting, today's presentation. And now we will turn it over to Jennifer Johnson to kick off the presentation. Jennifer.
Thank you. Sorry, thank you. Thank you, SAMHSA and the Gaines Center for inviting me to talk about this topic. This is something that I have been focused on pretty extensively since about 2016. In 2016, I co-authored a law review article with two doctors called Compassion, Fatigue, and Burnout in the Legal Profession. My strengths and my expertise are really in how compassion, fatigue, and burnout apply to attorneys. However, a lot of the information is really universal. I will say, for those people on this broadcast who are not attorneys, I just want to say I think it's wise to tune in. I'm not focusing exclusively on lawyers, but I think that as criminal justice professionals, we do much better if we have an understanding of our collaborative partners. Lawyers, love them or don't love them, if you're working in the criminal justice system, you're working with them. The judges are lawyers, the prosecutors, and the defense attorneys. It's sort of an unavoidable character that you'll encounter. So I feel that understanding what pressures are on lawyers may help people who are not attorneys have a better understanding of attorneys, and also have a little more empathy and take things less personally than you might if you didn't understand. So obviously, I begin everything I do in my world with the sequential intercept model. And today we're talking about intercepts 3, 4, and 5. And I spent most of my career, happily so, in intercept 3 in San Francisco's behavioral health court. I want to admit that at the time that I was working as a lawyer, I didn't have insight into, I didn't know about self-care. I didn't know how to take care of myself. I didn't always do a good job. And I wish that I'd had that information before. I wish I'd had it in law school, to be honest. I think I would have been a happier and a healthier person. So I want to just, I use this quotation a lot in the work that I do. This is a quotation by Charles Figley. And Charles Figley coined the term compassion fatigue. He did research on nurses, and that's where this quotation comes from, his book from 1995. It applies to everyone who's working across the criminal justice continuum, particularly with the behavioral health population. We've not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and curse of extreme empathy, and we suffer. We feel the feelings of our client, we experience their fears, we dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We aren't sick, but we aren't ourselves. I think that applies, I think, the perfect quotation for what we face. We don't necessarily know, and sometimes these things can creep up on us slowly, and we might not have insight into what is going on. This is a hard job, and working with people who have a serious mental illness and substance use disorder, that are facing criminal charges, that often have not one or two issues, but many: social service, the lack of services, lack of access, medical problems. It's quite a population, and I think we need to be kind to ourselves and our colleagues in how we approach both our clients and each other. So for attorneys, why does this matter to attorneys? All court professionals are at risk of developing burnout and compassion fatigue. I'm going to distinguish those two things from each other in a minute. This is also sometimes called secondary trauma and vicarious trauma. There are subtle differences between these definitions, which I think for the purposes of this conversation don't need to be illuminated. So for lawyers, we work under stressful conditions with limited resource sources, particularly in the criminal justice system. And now with COVID, those resources are even more limited and difficult to access. We also witness stories of tragedy and human-induced violence. That's part of what we do. And for attorneys as a profession, we have exceedingly high rates of substance abuse, divorce, suicide, and health problems. I want to note here, after we wrote our article in 2016, in 2017, the American Bar Association came out with it's called the Path to Well-Being. The National Task Force on Lawyer Well-Being focused on two studies that had been done showing that lawyers have exceedingly high rates of problem drinking, depression, and anxiety. And also law students had very high rates of the same. So the American Bar Association came to the conclusion that despite, they came to the conclusion that given all of these issues, the profession going along as it is not sustainable. It's on a crash course. And I think it's something that we have to address and reverse by teaching lawyers how to take care of themselves. At the end of the day, we have a duty to provide competent representation. That is what we have to do. If we don't, then we can be disciplined. A lot of things can happen, and when we're not well, we may not know that we're not even providing competent representation. So here are a couple of statistics on practicing lawyers. They're more than 3 times more likely to suffer from depression and twice as likely to have addiction to alcohol or drugs than non-lawyers. Leading cause of death for lawyers: cancer, heart disease, and suicide in that order. I think it's important and very important to point out that we may think of the stress affecting us in an emotional way, but we don't often focus on the fact that it affects us in a physical way, that it can make us physically ill and it can make our lives shorter. That, I think, is powerful to know. Some of the individual risk factors for attorneys they are often overly conscientious. In the criminal justice system, a lot of lawyers have self-giving personality traits. As we know, being a public defender, a district attorney, or a judge is not the way to riches necessarily. We often have unrealistic expectations of ourselves, and a lot of pressure and expectations from the people we represent, their families, to perform and to have answers and to solve problems. That's what we do. We also may have low levels of social support. Sometimes the things that we encounter in our criminal justice system are not things that we can talk about to people who don't understand. It can be upsetting and traumatic for the people in our lives, and I think that can limit our social sort of network. I remember when I was a young lawyer I was actually doing death penalty work, and I felt as though every time I would walk into a social setting that I had this black cloud. And if I started to talk about my work, it would lead to conversations about criminal justice. And it was, I started saying I'm a tax attorney just because nobody wants to talk to a tax lawyer. So if you're a tax lawyer out there, I apologize. But it was this sort of burden that I carried and that I could share with my colleagues at the office. But then if you're only sharing with your colleagues at the office, you're not getting away from it. So it can dwindle your social support network. We also may have high levels of stress in our personal life. As I said, there are high rates of divorce and even high rates of suicide. We aren't really trained on this. I teach at UC Berkeley. I teach mental health and law, and we teach a class on compassion fatigue and burnout. But for many these young lawyers for the lawyers that came before us, they didn't have that. It's new, and law schools are trying and beginning to address it, but we aren't really trained about mental health, and certainly not about our own mental health. We also don't necessarily have insight into the symptoms of distress, the ways that we cope. We may not realize that going to the bar after work is actually a symptom of compassion fatigue and not just a way of relaxing. It may be that also, but we don't necessarily recognize that the things that we're doing may actually be symptoms. And we engage in poor coping strategies. Like I said, you get a good verdict, you go to the bar. Get a bad verdict, you go to the bar. There's a real issue around alcohol in the legal profession, and it being a culture and a way of life that needs to change. So we also have institutional risk factors. In the law, there are just things inherent about it that can lead us to distress. One of those I'm going to talk about in a bit is the adversarial system. The adversarial system is counter to our biology. It is, we are in fight mode a lot of the time, and that can wear on us in various ways. There's also, certainly in criminal law, kind of a Lone Ranger mentality, where many criminal lawyers they're responsible for everything. There isn't a lot of a multidisciplinary work model that we have adopted in the criminal law. So it can be isolating. We also have a duty to zealously advocate for our clients that doesn't go away. And we also have a duty of confidentiality. These things I'm going to talk about a little bit more, but they can be very burdensome. As I said, this is the institutional problem, little training in mental health and substance use, and very little emphasis on self-care from the top down. There's stigma around seeking help and being seen as weak, and having a mental illness or having a mental health disorder is viewed sometimes as weak. So the culture of the profession is also very slow to change. So those are some institutional risk factors about the profession that can lead us to distress. Specifically, the adversarial system puts our nervous system into a state of heightened alert. It engages, and I'll talk about this, a whole set of processes that are out of our control. If we remain in that state, that response can become generalized. We can end up in a chronic, vigilant, and reactive state where we become brittle. We see the world as us and them, black and white, and we suffer not just emotionally, as we may think, but as I said, physically, and most importantly, cognitively. The stress of constantly practicing in a courtroom that is adversarial can affect our brain, and that is hard to see when you're in the middle of it. Eventually, that stress erodes our problem solving, communication, and conflict resolution strategies, the very, very things that we are tasked to do as lawyers. The other thing I think is important is the duty of zealous advocacy and confidentiality. We don't choose, lawyers in the criminal justice system, the cases that we have. We don't choose the clients that we have. And it doesn't matter. We are tasked with representing them. And it can force lawyers to subordinate their emotions to the needs of a case. You push it down. And we aren't given a lot of freedom or choice in what happens. It may be as simple as what day are you in court? You get your new cases, and that's what you go forward with. So it's that and the duty of confidentiality. We can't really share those painful things with people who are outside of our world. Our clients tell us some things that are so painful, disturbing, and they can contribute to our own medical and mental health conditions if we don't have an outlet, if we don't have a way of expressing those things and getting away from it, really. I want to talk a little bit about the specific aspects of collaborative courts. I wrote a piece about this for a SAMHSA newsletter because I think I feel like it's an important thing to think about. So people working in collaborative court have different and specific risk factors, and there's also resilience factors to protect people working in those courts. One of the risk factors is this, we have a more personal investment in clients. Clients are often in the court for a long time, much longer than they would be in a regular criminal court. We are privileged to know more about their lives, their personal lives, their struggles. And as human beings, we become invested in watching clients who don't do well. I've experienced clients who've committed suicide. That attachment that we have to our clients and to the people that we serve can take a toll. It's also a more complex population of people that need to be in a collaborative court. Exceedingly high rates of trauma, high rates of mental health issues and serious mental illness, and high rates of co-occurring substance use. That is, I used to say to people, my clients don't arrive with one problem. They arrive with 25, and it doesn't, what I think is the most important problem isn't necessarily what they do. So we have to work with a broad range of some pretty difficult life circumstances, and that can be hard. So those things could make us more susceptible to negative and dysfunctional coping mechanisms. On the other hand, there are things about a collaborative courtroom that help us. Number one, I think this is so important, it's cooperative, non-adversarial courtroom. by not engaging in that adversarial process where we throw our body into fight-flight mode every day, we are going to ending up in a situation where that sort of fight-flight becomes chronic. And I'm going to explain a little bit about that when I talk about the neurobiology of trauma. We also have a multidisciplinary team. I said earlier that sometimes law is a lone ranger situation. Collaborative courts are not. They require a team. That is the very definition. And also, we have a deeper understanding of mental health. We know what mental health issues are. Also, we see clients succeed. For me personally, in the mental health court, I can say that one client's success could help me get through a lot of failure. It's something very powerful to watch somebody get into recovery, to stay, and to get their life back. It's the reason I stayed in a mental health court for 16 years. We also have more resources. There's less stigma around mental health if you're sitting around a table of people who are therapists, who understand mental health. It's not such a leap, and it's not viewed as a weakness. So there are specific things I think about collaborative courts, and I sometimes think that criminal lawyers should rotate through collaborative court assignments just to see that and just to experience some of those resilience factors that are really pretty unique and I think extraordinary. So what is unique about Intercepts 3 and 5? There's one bullet point that I'm actually gonna have you move in your mind. Intercept 3, where we don't have collaborative courts, there is a more adversarial courtroom atmosphere. This first bullet point actually belongs under Intercepts 4 and 5. Obviously, there's more adversarial courtroom, and that can lead the participants in that courtroom to have to encounter more, just more of that fight-flight, as I talked about. Intercepts 4 through 5. Now, reentry and community corrections, we're looking at this first bullet point. We're necessarily more involved in law enforcement. Corrections, probation and parole are arms of law enforcement. And sometimes when people are on probation and parole, they're there because they weren't diverted out of the system early on. And they have more criminal liability that can lead to a more adversarial environment in those courtrooms where we're hearing probation, parole violations and revocations. And people are facing state prison, which is something that if we can avoid it, we don't want people with serious mental illness and addiction issues to go to state prison. So there's a bit more pressure at Intercepts 4 and 5 on everyone who works in those different intercepts. The other thing is that by the time people get to Intercepts 4 and 5, they're more institutionalized. Many people are caught in a horrible cycle of recidivism. Sometimes clients are people who were left on the streets when we deinstitutionalized and have been stuck in criminal justice since. Often they have long criminal histories, they may have more serious crimes, and they may have much more entrenched behavioral health problems. So working at Intercepts 3 through 5 for practitioners, for the whole team, has unique aspects to it. So I think it's just important to recognize that. And I'm very grateful that Judge Hirsch is on this program because she knows a lot more than I do about some of these things. So she's going to supplement this conversation with her realm of knowledge, which I think is complements what we're talking about now. So this part is universal, and I'm kind of fascinated about what happens to a body under stress. Stress triggers a primitive biological reaction. It's in our amygdala, in our lizard brain, we often hear. It's meant to protect us and keep us alive. It's a good thing. It puts us into fight, flight, freeze mode, where we release stress hormones, cortisol and adrenaline. When stress becomes chronic, our bodies aren't able to return to a normal state of arousal. And the long-term consequences of living in that state are burnout and compassion fatigue. Just a little, this is my lawyer's way of understanding complicated science. Stress activates the fear center of the brain. Our body hits what I call the gas pedal. We have a thing called the vagus nerve that runs from the base of our skull through to our gut, and it's an information freeway. It goes to a lot of our bodily systems. When that happens, when we hit the gas pedal, the vagus nerve constricts. We release those stress hormones. Our heart rate goes up, our pulse goes up, our breathing increases. Our pupils dilate, our blood sugar rises, and we get blood flow to our arms and legs so that we're ready to fight or flee. It's entirely biological. It's entirely normal. This is how we're supposed to react. We may not even recognize that this is going on. We can't control it. Now, in a normal situation, when the danger passes, the parasympathetic nervous system engages. And what that does is our body hits the brake. That vagus nerve that runs through from our brain to our belly releases, and it counteracts the stress hormones. Our heart rate and pulse go down, our respiration goes down, our body saves its sugar, it saves its energy, and puts us in a state of relaxation. And this is a quotation from the article that I co-authored. And Dr. Lee Norton is a marvelous expert in traumatology, but chronic fight or flight freeze reactions become ingrained in our system. And at the end of this, she says, in short, we make ourselves mentally and physically ill. That's what happens if we're in a chronic state of that type of stress. So what is burnout? Burnout and compassion fatigue are different. Burnout is a gap between expectations and outcomes where demands are greater than perceived resources. Too much for too long, long hours, organizational failures, few resources, the litmus test. Do I love my work? No, I hate my job. It can mean a loss of interest in work. It has no value. We don't have a sense of accomplishment. We become cynical. We have no humor or dark humor. And we don't have enough will to power through it. One of the consequences is self-medication. Compassion fatigue, on the other hand, is the cumulative physical, emotional, and psychological effect of exposure to traumatic stories when working in a helping capacity. Compassion fatigue is about the content of the work, not about the resources and the demands of the work. It's about what we see when we go to work. It's about those stories. And I'm not going to go through all of this. I think it's clear to say there are quite an array of symptoms of compassion fatigue. They fall into three domains. Physical, which is, as we said, when we engage that nervous system, changes our breathing, our heart rate. We may have difficulty falling or staying asleep. We might have problems with appetite and digestion. Remember, that vagus nerve runs from your brain to your belly. Maybe headaches, decreased libido, chronic musculoskeletal pain, and decreased immunity. These are important physical manifestations of the stress that we're under, of compassion fatigue. And the emotional symptoms as well. Fear and anxiety. We may have inexplicable guilt. We may ourselves withdraw. We may become angry and irritable. I think we don't think of that as a symptom of depression or an emotional symptom, but it really is. We may feel powerless or numb. We may be overwhelmed by small things, and we may overly focus on cases or clients. And then lastly, I would say the cognitive symptoms these are the ones where our thinking is affected. Could be rigid black and white thinking. We may not be able to concentrate. We might have confusion and memory loss, a loss of direction, inability to recognize cause and effect. This affects our brain, how our brain works, how it thinks, and that's what we count on to get us through the day for everyone who works in this field. The long-term consequences are serious. Self-medication, relationship problems, medical problems, mental health issues, and poor work performance. We don't really want to live the consequences of stress, and we have the ability to mitigate it, and we need to. So Judge Hirsch is going to talk a lot more about these individual sort of self-care tricks or strategies that we can employ. But to increase our resilience, it's building where we have those risk factors, a supportive network, getting away from work, having this bullet point at the bottom, time away commensurate with the nature of the work. That is really important. A day off here and there isn't going to do it. And exercise, diet, mindfulness, those are all things that we should be thinking of. And then we also have to increase institutional resilience. We need to hold our institutions accountable and insist that they help us take care of ourselves. Proper training from the top down, training for management. Sometimes supervisors don't know how to manage people. We need to set reasonable expectations for employees, and as I've focused on a little bit in here, a multidisciplinary work model. We need to provide adequate resources, and also adequate resources for emotional support, and reducing the stigma of actually accessing those resources. So just to wrap up, the National Task Force on Lawyer Wellbeing if you are a lawyer, I recommend finding this document on the ABA website. If you're not a lawyer, these things are applicable to everybody, but we have to identify, this is what they suggest to change what we're doing, which is identify stakeholders and the role that each can play in reducing the level of toxicity in the profession, ending the stigma surrounding help-seeking behaviors, emphasizing well-being, expanding our educational outreach, and then changing the tone of the profession one small step at a time. We can do this. We can be healthier lawyers. To be a good lawyer, you need to be a healthy lawyer. And if you're a healthy lawyer, maybe the rest of the collaborative court team will work better with you. So with that, I am going to turn this over to Judge Hirsch.
Thank you, Jennifer. Good afternoon, everyone. I am thrilled to be here today to talk to you about something that I really think is so important for all of us in our professional and in our private lives. I'd like to also thank the Gaines Center and SAMHSA for inviting me to participate today. All of us realize that COVID has been a very, very stressful situation. It's for all of us in the criminal justice system. We can kind of look at it as the great unknown. A year ago, most of us had not even heard of the word COVID, and now just think how it's impacted your lives. We think about it constantly. We're inundated with images and news stories and television stories, and we keep hearing all of these stories from all of our staff members, our family members, and it's universal concern to all of us. In mid-March of last year, we thought when we packed up our desks to go home that we'd be working from home for 2 weeks, not for months on end. I sit in New York City in Queens County, and we were at the epicenter of COVID. Some of you may have heard our Governor Cuomo, talk about COVID arriving in JFK and our airports and LaGuardia airports here in Queens. And many of you have probably seen pictures in March and April of Elmhurst Hospital, which was and is down the street from my courthouse here. That was the big white hospital that had the mobile morgue in the back because so many people were dying in March and April and May here in my county. So our team for our treatment courts and our staff here in the courthouse has been tremendously impacted by COVID. Our city was on lockdown. Staff members and their families got COVID, were very, very sick, and couldn't even get a COVID test. Our work lives changed overnight. Some of us who may have had a fear of technology were suddenly inundated with different platforms. Were we going to be on Zoom? Were we going to be on Skype for Business, WebEx, Microsoft Teams? And just as soon as you learned one platform, your organization switched to another, which was stressful in and of itself. We had to determine whether there were going to be in-person parts or virtual parts. Attorneys didn't want to come into court. There were conflicting memos from administration, and then again, coworkers were getting sick, family members were getting sick. Everyone on our team was facing home stressors as well, loss of a spouse's job, income, homeschooling. Those of you who are homeschooling your kids, you have my admiration. I do like the story about the kid who says, I hope I don't get the same teacher next year because she's really mean. Some of you can probably identify with that. We all experienced a loss of support and caregivers. Daycare was lost for some of our team members. The ability to spend time with grandparents was lost. Extracurricular activities were lost for both our children and for ourselves. Our lives were turned upside down. Jennifer, my co-presenter, did a great job of explaining compassion fatigue and building resilience for attorneys in Intercept 3. I want to take a moment here at the beginning to say that much of what she said for attorneys applies to judges as well. Judges are impacted by the people in the cases that come before them, and they too can suffer from secondary trauma and compassion fatigue. They can also suffer from decision fatigue. It's hard work being the final arbiter at the courtroom and in chambers where we are constantly impacting other people's lives. I know on some Friday evenings after a tough week when my husband comes home and says, where should we order dinner from? It used to be, where can we go out to dinner, but now we're all ordering in. I tell him I've made decisions all day. He can make that one. Same thing goes for movies that we watch. Sometimes we're just too exhausted from making decisions all day long. Being a judge can also be very lonely and isolating, and that isolation has gotten worse with COVID. We're not together for meetings or lunch. We don't see each other in the courthouse. We can't bounce ideas off of each other. Our capacity in our building right now has been reduced to 25% of staff. So it's very, very isolating. So for my judges on this call, I hope that some of the self-help measures that we're going to discuss here will really help you. So how do we measure our own compassion satisfaction and compassion fatigue? When I give this presentation in person and have a much larger block of time to work with, I pass out the professional quality of life scale to my audience. That's the link. You'll see that at the bottom of this slide. I urge you all at some point in the next week or two to please print that out and take that test. It's very simple. The link indicates, and it starts with the sentence, I am happy, or I am, and then it goes on to I am preoccupied with more than one person. There are 30 of those simple statements. And please, if you have done this before, do it again. Times change, circumstances change, you change. Be honest. No one will see this but you. Score it. This simple exercise will give you 3 separate scores, one for compassion satisfaction. Let's face it, that's the best thing about the jobs and the work that we do. A lot of us get enormous satisfaction and feel really good about helping others, and really making a difference in the lives of the people who come before us in a positive way. You'll get a scale for burnout, and you will get a scale for secondary traumatic stress. If your scores raise any concerns for you, I urge you to discuss them with someone that you trust, a mental health professional, your family physician, a therapist, an employee assistance professional at work. You may have resources through your union or a trusted member of the clergy. Do not be afraid to ask for help. Okay, we pretty much, Jennifer did a fabulous job of describing all of these boxes, so I'm going to move along here. And right now, because I am covering Intercepts 4 and 5, I would like to turn our attention to those of you who work in reentry and corrections. We know that you faced a lot of challenges during this pandemic. You and your colleagues may have gotten sick with COVID. You may be worried about bringing it home to your families and your loved ones. One counselor who I spoke with at Rikers Island, which is our jail here in New York City, told me that he was worried every day because there was not a mask mandate within the individual units in the jail. Inmates had to wear masks when transferred between units, but not within their home unit. So this staff member was very, very concerned about possibly bringing COVID home. Another told me that there was not enough PPE in their units. Another indicated that after 9 corrections officers died from COVID, administration stopped reporting the numbers. And she said transparency was dead. A frequent complaint from the corrections officers also was that corrections is more worried about the safety of the inmates than they are about the staff. Then the bail reform movement also changed the census in our jails. Judges were being asked to release those with underlying health conditions who were at greatest risk for getting COVID. Corrections officers indicated that this left them to deal with some of the more violent inmates who now also were frustrated because of the uncertain length of their stay within the jail. And court systems were transitioning from in-person parts to virtual, with hearings and trials delayed for months. Did this add to the stress and the tension within our jails? You bet it did. As this study indicates, the experiences for reentry program staff among correctional employees, they expressed high levels of post-traumatic stress disorder symptoms, burnout, secondary or vicarious trauma, high levels of emotional exhaustion, intense levels of stress, high levels of depersonalization, high levels of intrusion, avoidance, and hyperactivity. We also work with probation and parole officers, probation officers in particular on my team, and they face some very challenging and unique situations brought on by the pandemic as well. Those that work in a case manager capacity have faced overwhelming demands from clients and their agency, leading to high levels of burnout. Because they got to know their probationers on a one-on-one level, hearing about or witnessing traumatic events involving their clients also could result in vicarious or secondary trauma. When I spoke to the probation officers in my part as I was preparing this presentation, they told me uniformly that they all missed the one-on-one, face-to-face contact with their clients. They said you lose something when you see someone on a screen. The probationer may be reluctant to open up, sessions are rushed, technology can be problematic, and I didn't think about this before, but I want you to think about this now as you're looking at your screens. Body language is much harder to read. The biggest stressor also for my probation officers were that multiple court parts all seem to want everyone to log in at the exact same time. One officer told me that she worried about her probationers who are also victims of domestic violence, as you couldn't see that person's whole body on the screen, and it's much easier to cover up the bruises. Similarly, she said that she couldn't tell anything about because she didn't have a sense of smell, she couldn't tell anything about the probationer's hygiene through the screen. Some probationers may have lost their housing and be homeless and unable to shower. Some may have started relapsing, and I do a DWI part, and so you certainly couldn't smell if someone had been drinking alcohol through the screen. So there were other challenges there, and some of the probationers might have been embarrassed to bring up these issues by talking virtually to their probation officer. There were also logistical issues. If home visits were scheduled now, they were done outdoors. Our probation officers are used to also looking inside refrigerators, seeing, is there food in the household? Do people have resources to feed their children now that a lot of the school lunch and breakfast programs were closed? All those things are gone now because of the pandemic's effect. It was also difficult to get the incarcerated on video hookups from jail, and probation officers also mentioned the biggest drawback was the lack of personal connection with their probationers. So these comments about work during the pandemic should be examined through and we're going to look at that now on this next slide. And some of these things have been studied as well for our corrections officers. And here you'll see the big takeaway here is that corrections fatigue is prevalent. 69% of corrections officers who were studied here in 2013 had levels of stress that were unsustainable without significant costs to the body. Just like we looked at the Professional Quality of Life Index, I'm also going to suggest that you take this quick guide, Suggestions for Prevention and Intervention by Dr. B. Hudnall-Stamm, and work through this on your own as well. What I like about it is the individual level, which explores factors and risk factors for you as an individual, and then look at it at the work group level. Look at it with your team. You may want to share this with your colleagues at a team meeting. You can do this over Zoom or whatever your current platform is. There are helpful suggestions here to share the load of difficult cases. Ask colleagues for help. Take a time out when you need it. Or if you find that your work environment, and some people unfortunately do work in environments that they label as toxic, if you may have to find some support outside of your work setting. Maybe other colleagues who work in different places but do the same job as you, they might be helpful. Review the approaches to enhance self-care across your organization. So also I encourage you to work on this as well with your team, and you might come up with some additional ways to manage the stress and the factors that are challenging for you at this particular time. The invisible effects of secondary trauma, please note that many of these symptoms are involuntary and unconscious and are initially not noticed. But they represent a change, and you are seen now as not how you used to be by others who know you. Something about you may have changed. Your basic worldviews can change. Some people who are experiencing burnout or compassion fatigue have talked about changes in spirituality, changes in identity, how they practice, how they do their job, how they practice as a professional. How their relationships with their friends and family members may have changed. Some people become withdrawn. Changes in psychological beliefs, their sense of safety, control, trust, esteem, intimacy. All those things can change. So now let's look at what the research is telling us about COVID's impact on our mental health status. I really liked this slide that was prepared by the Centers for Disease Control and Prevention last year. They surveyed people across the country and found something pretty interesting. They found that 40.9%, the all respondents, top line all the way over to the right, of Americans reported at least one adverse mental or behavioral condition, those being anxiety disorder, depressive disorder, and anxiety or depressive disorder or COVID-19 related condition, with 13.3% of respondents having started or increased substance use to cope with the stress or the emotions related to COVID-19. In that same study, CDC revealed that over 81,000 drug overdose deaths occurred in the U.S. in the 12-month period ending May of 2020, and that was the highest number ever recorded by the CDC. More than 40 states have reported annual increases in opioid overdose deaths, as well as ongoing concerns for those with a mental illness and substance use disorder, according to the American Medical Association. Okay, moving to... there's a very, very interesting study out of England which looked at 70,000 adults over the 20 weeks after the lockdown was announced between March 21 and August 9. And they found that the anxiety and the depressive symptoms during enforced isolation resulted in some really interesting facts. First of all, they found that the anxiety and the depression levels declined across the first 20 weeks following the lockdown. And the fastest decreases were seen across the strict lockdown period. But then symptoms plateaued as further lockdown easing measures were introduced. But the most interesting takeaway here was they found individuals really adapted to the circumstances, but groups that already were at risk for poor mental health before the pandemic, and that included women, young adults, especially they said the less educated, lower income, those with pre-existing mental health conditions. If an adult lived alone or was a single parent and was responsible for children as well, they remained at risk throughout the entire lockdown and its aftermath. This interesting study came out of Nevada. Nevada health officials showed that with the second epidemic that was then sweeping the state in November and December, that there was a dive in mental health wellness and an alarming surge in depression and anxiety. NAMI, the National Alliance in Mental Illness, their mental health hotline in Nevada saw more than a 200% increase in calls this year. In 2019, there were 3,300 calls. For the first 11 months of last year, in 2020, there were 10,500 calls. They also indicated that in 2,300 hours of hotline calls, COVID-19 was mentioned as a stressor in about half the calls, and then depression, anxiety, and social isolation were mentioned in about 80% of the calls. Many were first-time callers, and then many also indicated that secondary financial and relationship issues were reasons for their calls. This study that came out of Brussels also showed that the social and mental well-being was getting worse as the epidemic continued in Belgium. And these are large studies. This one looked at 30,000 people, and they felt that people felt they were not receiving adequate social support. They were unsatisfied with their social contacts. And look at that number. It almost doubled between earlier in the year when it was taken in September, and then 64% in December. Also, we did see people who drank alcohol. In the fifth survey, found 29% were drinking less, 20% were drinking more. Smokers, more were smoking more, 20% were smoking less. Drug use increased from April to December. And this one I thought was really interesting, the use of sleeping pills or sedatives. 21% used them, and 42% of those said consumption started or increased since the study. So, what's our takeaway here? Anxiety feelings tend to rise and fall as COVID numbers went up in people's communities, and depressive feelings tended more to track the tightening and the loosening of control measures, meaning if people were going to be stuck in their households for a longer period of time, they felt more depressed. When those restrictions started to loosen, they felt better. So let's talk about some protective measures here. Take care of your body. Be mindful of your physical health. Participate in regular physical activities that you enjoy. Dance, walk, find an app that you enjoy. As Jennifer was talking about about alcohol and drug use, it's interesting to note that vaping or smoking increases lung disease, and people who might be susceptible to COVID, who vape or smoke, may get the disease, may suffer from more serious consequences of that disease. Take care of your body. Alcohol can reduce your coping skills. Relax and recharge. Deep breathing, yoga, tai chi, meditation, bubble baths, listening to music. Reading, listening to books, watching a favorite movie or TV show, whatever helps you relax. Eat well. Take care of your mind. Reduce stressors. Stay away from those Debbie Downers and those toxic people who are going to bring you down. Keep your regular routine. Stay busy. Focus on your positive thoughts. Use your moral compass or your spiritual life to help support you. I really like this next one about taking care of your mind and setting priorities and reasonable goals. Pat yourself on the back. Give yourself credit for what you've accomplished, no matter how small. Realize that some days are going to be better than other days. Recognize what's typical and what's not. Ask for help when you find it hard to carry out normal responses. Stay in touch with your friends, your family members, your coworkers, again, who are positive influences in your life. It's not the time to search out, as I said, the Debbie Downer or the person who's going to bring you down. Take care of your mind. Get and provide warm, comforting social support. By being in the professions that we're in, we tend to want to help others. So we do find that doing those good things, giving food to the food bank or contributing to a favorite charity or volunteering your time to help out with a local community-based group that is helping others during this time of COVID, that might really help you as well. Get outdoors, spend time in nature, rest, breathe, find ways to express kindness, patience, compassion. Implementing these steps to building long-lasting mental and physical health. This article came from Dr. Sanjay Gupta in the AARP magazine, where he talks about maintaining social connections, eating for resiliency, moving more, get healthy sleep, learn something new. He talks about participating in virtual chats, focusing on eye contact, maintaining and creating new relationships, eating for resiliency, move more, participate in virtual exercise classes. I know we've been doing that in our community. There are also some terrific fitness apps that you might want to use. Or combine. I like to take my cell phone and walk and talk to people that I haven't talked to, friends in different parts of the country that I haven't talked to in a while. You can really feel a lot better when you get back from that walk if you've had a good visit with an old friend. Get healthy sleep. Keep a dream journal. Learn something new. You can do that in courses. You can do that on YouTube. Whatever you like. Learn a new language or why don't you think about going back to those high school Spanish and French classes that you took and delving into that again. Free self-care exercises. These are also simple things we can do every day and will help our mental health and well-being. Stay hydrated. Put your phone on Do Not Disturb. Stretch. Declutter your home. I like this. Watch the sun rise or set. Doodle. Read a book. Do a jigsaw puzzle. Meditate. Practice calm breathing. And create a gratitude list. Even in the middle of these challenging times, there have to be some things that you're thankful for. And if you look at those things that you're thankful for, that too will improve your overall mood and will help you in your work life as well. So I think now we're ready to move on to questions. Here are some references, and I'm going to turn this over to Melissa.
All right. Thank you so much, Judge Hirsch and Ms. Johnson. So now we would love to hear any questions coming from you all in the audience. And as a reminder, you can submit your question through the Q&A pod at the lower right section of your screen. And several of you did ask for the link to the publication that John Berg referenced earlier in his opening remarks, and we have posted that link, pardon me, both in the chat and in the Q&A. So one question that I have for you, Judge Hirsch, and also Jennifer, I welcome your thoughts on this as well. As you think about the impact of COVID and some of the numbers and the statistics that you shared, what is the sense of how the social justice and unrest related to racial disparities, how do you see that overlaying some of the challenges that criminal justice staff are facing amidst the COVID pandemic?
That's a great question. I think that the social justice movement has really impacted us all greatly. And I know that in our court system, our chief judge has taken a very active role in looking at racial inequities and disparities both within our court system and within our criminal justice system. And I think we are seeing a greater movement right now toward examining those disparities, and a lot of studies and panels have been formed to look at possible solutions. So I think we're going to be seeing some really positive impacts and changes that are going to be coming out. I know that even in prosecution of low-level crimes, here in New York City, we're seeing a decrease in appearance tickets in prosecution of lower-level offenses, which impacted more upon our poorer and our African-American and Hispanic communities. So I think we will see some positive change, and I think COVID has given us another lens to look at this and examine it and give us a way to do things better going forward.
Yeah, I would agree with Judge Hirsch. I think that COVID has actually opened our eyes to the fact that a lot of the racial inequity problem that we saw through the Black Lives Matter protests and the COVID pandemic track each other, and I think that it's forced a conversation that I don't think can be ignored any longer, and I'm hopeful for really meaningful criminal justice reform in terms of, it's caused an added layer of stress. I now work part-time for the San Francisco Sheriff, and in law enforcement, it's been a very difficult time, just being in the spotlight. I just read an article this morning about public defenders and the levels of stress that they are under because of these dual issues. They go hand in hand, I would say.
Yes.
Thank you for that. And we did have a few questions come in as you were responding to that question. And so one person asked about a training. So if both of you know of something that fits this, if not, no worries. But she asked, they asked, is there any training that either of you host or any of us host that focuses on teaching the system entities to work together and follow an evidence-based model? It would be great to get judges, lawyers, care coordinators, probation, and providers together to work on how collaboration should go. So any thoughts, either Judge Hirsch or Jennifer?
I think there are a lot of opportunities for cross-training, and I know that we as a team, in my courts, we do a lot of different trainings. I know the Gain Center offers trainings. The National Association of Drug Court Professionals offers these type of cross-collaborative trainings. The National Judicial College also has looked at this issue. SAMHSA sponsors different trainings in collaboration with other organizations. And your individual states also may sponsor some trainings in these various areas. Jennifer?
Yes, I would say that, Judge, I agree that there are things that are available more and more. I do a lot of teaching and training, but as I said at the beginning, my focus is primarily on attorneys. But I think that what we need to do is sort of spark the sense of urgency to get people to go to these trainings, to realize that they need to work in a multidisciplinary way, that they don't understand the physiological impact of stress on our bodies. I mean, it happens to everybody. You're not just, it happens to all of us equally. So how do we spark that sense of that this is not optional, this is necessary? I don't know how to do that. But I think as a community of mental health and criminal justice professionals, we need to think about that.
Yes, I agree.
And I agree too. I'm not aware of any training that brings a multidisciplinary team together to talk about self-care or vicarious trauma. So as Judge Hirsch mentioned, the Gain Center does provide a training about trauma for criminal justice and behavioral health professionals who work with individuals involved with the justice system. And, the main focus of that trauma training is focused on clients coming into the system working with individuals who have a trauma history. We do have a few slides where we do talk for a few minutes about vicarious trauma and compassion fatigue and burnout, but it's not the main focus of that training. And so there is a real need. I think that's one reason why the Gain Center was so compelled to do these 2 webinars focused on self-care, because there isn't enough out there to really address this for our criminal justice partners. And so this person, she responded also wanting to provide input in the conversation and said, they said, the issues we see as care providers is the attitude of those in the justice system, especially probation, who do not get a lot of training in mental health. And so, the lack of training really seeping into the work that's provided there on a daily basis.
The other thing that I do want to point out is anybody who does work in a treatment court setting, our probation officers are very very valued members of our team, and we include them in all of our trainings. We also have stakeholder meetings quarterly where we invite different community organizations who we work with, and we pick different topics that are of interest, and we've had some wonderful mental health professionals come in and address issues with our team. And I think that collaborative approach and having everyone trained together has really benefited our team. And I'd encourage you to do that and map whatever resources you have in your community, invite them in. I'm sure that you have local professionals who would love to come in and love the opportunity to speak to people from such varied backgrounds who work together in your courts or your systems.
And that's a wonderful
one
suggestion.
thing that
and I just wanted to add that there are so many resources in our communities that we may often overlook, so it might be worth your time to reach out to a local university and see, how they could work with you, or the local health department may be very interested in coming and providing some information around self-care. So that also helps build out some of that collaboration and cross-systems connections that are so valuable. Jennifer?
Yeah, I was going to say when I was a public defender, we created a thing called the Collaborative Court Speaker Series, and it was held at a neutral, federal court sort of auditorium, and we invited people from all parts of the criminal justice system. So there were lawyers, there were police, everyone was in the same room, and we tried to offer credit for law enforcement through post, for CEUs for behavioral health, MCLE for lawyers, to make it attractive to people to come. And I think it was a really interesting, I honestly don't know that it still goes on, but it was very helpful, and you're in a place where, you finally get to see what the people that you think you're fighting against may look like. I mean, I think what the hurdle that we have is we have a very fiercely adversarial system that doesn't really, in some cases, doesn't want to change. We've created collaborative courts out of nothing because we had a problem we didn't know how to deal with. But the culture shift in criminal justice and going from fighting to working together, I think everyone needs to understand that there's a place for both of those things. And to be able to switch between those two, it's not an easy thing for us to teach people to do or for people to recognize that they need to do. Anyway, so we did something on neutral ground that had a variety of speakers from all different areas that were diverse, and it was really successful.
That's wonderful. And the next question, I'm actually going to try to combine two questions. So one person asked, have either of you seen management implement ways to identify and help their staff with vicarious trauma and burnout? Another question, similar, somewhat related, the person asked, can you speak towards the balance between the need to develop and deliver critical services in new ways while also protecting staff who are public servants from burnout? So any thoughts from that more organizational perspective of what can be done to help balance and identify when staff are in a place where they might need some additional support?
I think you really do need buy-in from management. You need buy-in from the top. Because if you have an administrator who understands the negative impacts of burnout on their staff, they're going to be more willing to be creative in ways to balance the burden and to improve the workplace in general. I know that there have been studies done that show that if people are happier in their workplace and feel that they're getting support from management, they use fewer sick days because, taking sick days is, and taking a, quote, I'm sure you've had colleagues who've taken the, quote, mental health day because they felt burned out. So you need buy-in from management, and you need people willing to try new things, to balance workloads, or as I mentioned before, if you feel like you need a timeout, if you're dealing with a particularly difficult client or attorney, and you need a timeout, there has to be somebody like a buddy who's got your back, who can step in for you in a given situation. And a good manager will find those ways and will create those pathways for their employees to deal with their stressors at work and to reduce them so that they can be productive and not end up hating their jobs and quitting and moving on to something else, because job turnover in some of these stressful jobs is another problem for management. So it pays for management to buy in.
In some professions, the idea of self-care is kind of built in. I know that the therapists that I worked with in the mental health court, they had monthly supervision with their supervisor. Those things aren't built into every system. And again, I think it's about having the right training for the right audience.
Mm-hmm. Yes.
The thing that Judge Hirsch the things that Judge Hirsch was talking about are all these valuable ways to get yourself out of your sympathetic nervous system and to relax, which is what is important. The same things don't work for everyone. And I can tell you that they did this training at my office a bunch of years ago. It was a mandatory meditation. You had to be there. You had to be on time. You had to take your shoes off. And you had to meditate for 36 minutes or something. And I mean, I was in the middle of a homicide preliminary hearing. Like, I couldn't. It wasn't the right way to deliver that information. The information has to be delivered so that you can say to someone, you know what, if you're in a stressful hearing, if you're doing something stressful, go into the hallway and take 5 deep breaths. How we take care of ourselves has to mirror the ability and the need of the population and their ability to receive the information. And I think, but I think I can't agree more that it has to come from the top down, Judge. Yeah. That is the key, and not just comes from the top down. We need this training, so we'll do it. We'll check the box, but believing that it's valuable.
Exactly. And some people have found that having these workplace kind of retreats, even if it's just for an afternoon, some people have gone across the street or nearby to a park and just brought their lunch and some snacks and talked just outside, changed the environment. Don't do it in the office conference room. People sometimes feel inhibited and aren't willing to share their issues or be critical of situations in their workplace setting. But if you move the setting, if you're outdoors or if you're at a restaurant, remember when we used to go to restaurants and like have lunch and things like that? Those things, just being out and changing your environment allows people to be more open and honest.
Also, resisting that, I don't have time for this, I don't have time. No, actually, you don't have time not to.
Mm-hmm. Yes.
When lawyers are a very tough group, and that's who I teach. I'm like, okay, you're going to die. You're not going to see your daughter's wedding. Like, I have to go to that level of this is physical. You're going to have high blood pressure. You're going to have diabetes. These things are going to make you sick. And not every audience needs that hammer, but I think tailoring the conversation to the audience and maybe having clinicians help lawyers understand how to teach it would be great. Mm-hmm. I think there's a lot of room out there for cross education, but some agencies have their guard up and need to let it down a bit.
Yes.
And where we see where management might not buy in, welcome your ideas, but often what we suggest is, try to link management with other leaders who are in similar roles, and let your management learn from others who are leading the way in this area. So if your management is a judge, then mention Judge Hirsch and use her as a reference.
I'll speak to any of your judges. That's right. You have my contact information. If you need me to speak to I speak to a lot of judges. I'd be very happy to speak to your judge.
And so
I think another way to make this happen is
go ahead.
No, I was going to say, I think another way to make this happen is to get the organizations, the bar association, the associations to embed into their continuing education programs mandatory pieces for some of this, rather than voluntary. You can if you want. That gets you to the point where this isn't a luxury. This is a necessity. That's the way we need to talk about it.
Absolutely. And so I do want to just remind the audience that, the Gain Center does offer a trauma training for criminal justice professionals. And again, it is more focused on how to incorporate a trauma-informed response in your work with individuals coming into the justice system or involved with the justice system. But it also can serve to start to normalize the conversation around trauma and how it is also experienced by staff through vicarious or secondary trauma. So if you're interested in looking into more of that, it's available on the Gain Center's website. And so we are now in the last 5 minutes of our presentation, and we just want to cover a few more resources that are available for you. And you may have seen a poll pop up. Feel free to fill that in. That gives us a little more information about some next steps or some other information you would like to receive from Gain. And if one of your questions did not get answered and you would really like to get additional support or additional information, I have the contact information for the Gain Center at the end of this webinar. And we encourage you to reach out to our toll-free hotline or our email address, and we will do what we can to connect you with some experts that can give you some more information. So if we didn't get to your question, please don't despair. We can still answer it if you'll just reach out to us here at the Gain Center. In addition to that, there are several links that were just on the previous slide, and if you didn't get to, there they are again. If you are signed up for the Gain's listserv, you will get a copy of these slides, so you can get these links from that copy once it comes out. We also have a direct download available to you. So a file transfer box should have just popped up on your screen, and a file will be coming in soon. So now under file name, you should see something that says stress management. Click on that. It turns a darker gray, and then click the download button. And that begins the download process to put this document on your computer. And that is another resource available. Also, the certificate of webinar attendance, if you need this for your personal use, this is also going to be dropped into the file transfer box. You can click it and then download it. And we also have an upcoming webinar. So on February 22nd, we're going to talk about supporting family drug court participants through comprehensive case planning. And so really trying to bolster our focus on families and having meaningful case plans in place to do that. So if you're interested in that topic, please join us February 22nd at 2:30 p.m. Eastern. And again, if you're not on the SAMHSA listserv, the Gain Center listserv, here is a abbreviated link. Just type this into your preferred browser, and it will lead you to a place where you can enter your email address and get on our listserv. And this listserv will provide you with slides from, it will provide you with notifications of upcoming webinars, also other technical assistance opportunities provided through the Gain Center, and a monthly newsletter where we feature programs across the United States that are working across behavioral health and criminal justice. And then finally, as promised, here is our contact information. the SAMHSA contact information is at the top. And then we here at the Gain Center, you can reach us through the Gain Center webpage or the toll-free number listed below. And I just want to extend my heartfelt thanks to Judge Hirsch and Jennifer Johnson for their wonderful presentations today. We really appreciate the information and the empathy and compassion that you brought to today's discussion. And so thank you so much for your time and expertise, and thank you all for joining us this afternoon. I hope to see you on February 22nd. All right. Have a great afternoon. Bye-bye.
Thank you, Melissa.
Thank you so much.